President, Dr. Stacy NC. Good afternoon. As Zeta Phi Beta Sorority Incorporated marks 106 years of service, we are activating our Global Day of Service with this Founders Day, where it matters most. The power of She Community Blueprint is our direct response to Mississippi's maternal and infant health emergency. It brings social, health, and economic justice together in a coordinated, community centered effort. Founded in 1920, Zeta Phi Beta has always been a service organization rooted in action. For more than a century, we have worked at the intersection of policy, health, education, and community empowerment. Through our Stork's Nest program and our partnership with the March of Dimes for over 50 years, we have remained steadfast in addressing maternal health and infant mortality. This is not new work for us. This is legacy work. This work focuses on root causes and not symptoms. And now, it is my distinct honor to introduce a transformational leader whose vision, discipline, and unwavering commitment continues to elevate Zeta Phi Beta Sorority Incorporated. Under her leadership, our visibility has expanded, our advocacy has been strengthened, our systems have been modernized, and our culture of sisterhood has been deepened. She leads with clarity, compassion, and strategic purpose, setting a standard of excellence that resonates far beyond our organization. It is my pleasure to introduce the international president and CEO of Zeta Phi Beta Sorority Incorporated, Dr. Stacy NC Grant.
Thank you, Madam Regional Director. Appreciate that very kind and generous welcome. Good afternoon or evening, depending on when you're viewing and watching, but I want to start first with saying this is the day the Lord has made, and I will take a point of personal privilege and be glad and rejoice in it. Today is an exciting opportunity for us to be here on our 106th Founders Day, celebrating the visionary leadership of 5 young college co-eds who had a divine assignment that they said yes to the call on their lives on January 16, 1920, to create this sisterhood inspired by our brothers of Phi Beta Sigma Fraternity Incorporated to stand on scholarship, service, sisterhood, and finer womanhood. And today we are intentional about the way that we are gathered here on this 106th Founders Day to really stand for the needs of our communities, just like our founders did on that very day. Through our deeds and our actions, in light of the current threat to the livelihoods of millions of Americans with the loss of SNAP, Medicaid benefits, and numerous additional fronts, including the infant mortality crisis right here in the state of Mississippi, having been declared a public health emergency, Zeta is perfectly positioned to capitalize on our long-standing partnerships influential members and stellar representation of our trusted messengers deep within community. We're committed to leading by example and addressing the specific needs which prove to plague our neighborhoods. By confronting this health crisis head on, right here in Mississippi, we exemplify the impact of layering our long-standing programs and highlighting the knowledge of the work that we have done for over half a century with the March of Dimes. This Founders Day Power She Community Blueprint will serve as a model for our chapters to hold live activations in their communities to address the needs, which could be focused on a number of different issues, not always just maternal health, but we know it is all connected with the societal threats to our community. This event today is our opportunity to stand here with our partners to address the needs that have been outlined in the state of Mississippi, the Black Legislative Caucus of this state, the March of Dimes, and all of our partners that I'll be introducing. For me, this started with the Black Women's Roundtable and a conversation that we had in New Orleans, at Essence, and hearing the challenges that were happening. It almost seemed like we weren't living in the United States of America, that we could see the kind of threat to maternal health and infant mortality happening right in front of our eyes. And I sit and I pondered and I said, how can we speak up? Somebody has to do something, and that somebody is Zeta. How do we stand in the power of she, advocating for social, health, and economic justice? And as I continue to think through, for those who may not be familiar with me, I'm an unapologetic child of God, so I don't do anything without my steps being ordered. And the timing came when I said, let's follow up on what we can do. Little did I realize it was our very own soror leading the charge with the Black Legislative Caucus in the state of Mississippi, none other than Representative Zakiya Summers. And when I told her what we intended to do, she was excited to hear that there was even an interest to shine the light on national attention on what's happening here in the state of Mississippi. And after that, I started talking to our international team, and of course, here in the unconquerable South Central region, led by our regional director, Kenya L. Washington. Let's give her a round of applause. I gave her a call, and we're in the mighty state of Mississippi, led by Dr. Portia Ellis. And I shared that we were going to bring a national activation here locally so that we can do more than just identify the problem. I'm not a problem stater, I'm a solution-oriented leader. So what is the solution that we can bring to this particular crisis that's happening? So I want to thank all of the chapters and members, and I will name them at the close of this conference. But why Mississippi? This is one of the highest infant mortality rates in the nation. This state has been declared a public health emergency related to maternal and infant health, and health equity is the core component of what real social and economic justice looks like. So coming here, what we have identified as ground zero is our way of making sure that you not only get resources that we'll be delivering to the community, but put policy in place that we can reverse some of the systemic challenges that have happened here, and this is just a small example of what unfortunately is happening throughout the country. So we're going to get started with hearing about the current landscape. We're going to talk about community and policy solutions. We'll have a special presentation by the mayor, and then we'll have some of our partners come and give their statements of support on removing this crisis, saving the lives of mothers and babies, and impacting the holistic view of how we, as one another, we're not waiting for someone to save us, we're going to save ourselves. So with that, I'm going to turn the microphone over to Dr. Vernicia Wilson.
Good afternoon. And happy Founders Day, Saraz. Yes, yes, yes. For those of you, I didn't say happy Founders Day too. So I won't be before you long. I'm coming on behalf of Dr. Daniel Edney, our state health officer. He was in meetings all day. So he sent me. I'm the Maternal and Infant Health Bureau Director for the state of Mississippi. So I probably can answer some of your questions in lieu of him, but if you need him, we'll try to get him. So I want to start off. I asked one of the Saras, can I be interactive? She said, yes. I said, okay. So I want to start off with a thought with you all. And I want you to think about what I'm about to say. And then you'll know where I'm going after I say it. Women constitute half of the world's population, but birth all the world's population, right? So when we talk about maternal and infant health and we talk about losing mothers, and I'm going to share some real life examples in a few minutes of some moms we interviewed, and some of their stories are heart wrenching. And, well, I'll get there in a minute before I get into that soapbox. Okay. So where are we with maternal health? Thank God we're going down with the maternal deaths. Give yourself a hand because you all did that. With the state, we helped, but y'all did it. The community got out there. The Biden administration pumped a whole lot of dollars into maternal health. And guess what? The numbers in Mississippi are starting to decrease. We're starting to see it. Hopefully, we can report in our next report for this year a really big decrease than when we started. So we're starting to see that. However, it's our babies. We have lost about 3,500 babies over the course of 10 years. And the way we think about that is those are 3,500 little ones that didn't become citizens of Mississippi, that didn't lend to the workforce, that were not able to say, this is my first day of kindergarten, or this is my first birthday. So that's how we look at when we talk about infant deaths, that's what we're looking at. So right now, our rate is 9.7 per 1,000 live births. That's the state rate. Now, the African American rate is 15.2 per 1,000 live births. So we're much higher, and it has been like that. We looked at data for over 40 years, and it's been like that every single year for the last 40 years. So I want to put that on your mind for a second. Just think about the why. Why is the African American infant mortality rate so high? Why? What is different? Let me share something with you. So we did a focus group with African American women who given birth within the last 2 years in Mississippi. We did that study in 2024 with the help of Teen Health. I don't know if you all partner with Teen Health. Very good organization. I see it in the back. Okay, thank y'all so much for partnering and doing that focus group with us. I just want to share some of the thoughts of the questions and some of the responses we received. African American women who gave birth. So we asked them, was there anything about your birthing experience as a woman of color that might have been different from others? One mom said, doctors tend to overlook a misdiagnosis in women of color. Doctors underestimate the level of pain. That's the things we're hearing across the state. Become more sympathetic for women of color. We deserve the same level of care and support. Another one said, most white women easily get these needed services, unlike women of color. Some women of color are not enrolled in an insurance plan, and we know that. We see that. So some emergency procedures they can't afford become a problem. If they should be in a situation that require those particular procedures, they're saying it's a problem if I can't afford to get the health care I need. That's what they're saying. I think it's more of us being talked at, like instead of us having a mutual conversation and the doctor being concerned. I'm seeing that again when black women say that we are in pain, people think it's in our minds. These are real life people. These are real life moms that just gave birth. One of them said, I see there's still some sort of racial discrimination in our society. The white folks are more prioritizing maternal services, delivery, both pre and post pregnancy. These are real, and we have about 100 pages that we went through of that. So we have something called severe maternal mortality. I'm sorry, severe maternal morbidity. That is what we call near misses. So these are women who are on the birthing table and they almost died. You may have a family member like that. You may have someone you know that said, I almost died giving birth. We are looking at we call them SMMs. So SMMs, we're looking at that to try to curb, because some of those women do die. We're trying to curb that. We have a work group that we're looking at with severe maternal morbidity to talk to women to mean We can set up some meetings. We go across the state right now. We're doing 82 town halls. We're going to the community. Every county will get a town hall meeting. I do facilitate those. We want to hear what the problems really are from all 82 counties, because guess what? Every county is different. Some cities within the same county is different. So we want to make sure we get to the heart of the community, find out what the issues are, so we as a people, as a state, as a legislature, as a state agency, all state agencies, as organizations, partnerships, we can address it as a unit. Thank you so much. That's my time.
Thank you so much, Dr. Wilson. And those that are viewing across the country, this is the same cultural data that we're receiving. That is not just in Mississippi, and why we have to do these reports so that we can understand that we are human beings and our pain threshold is like any other person coming into a maternity ward. Being a mother myself and my first son, I really thought I was going to see my maker. I was in labor for 1.5 days. And if you don't know how to advocate for yourself and you don't have somebody else there to advocate for you, we get those results that we were hearing about with women having permanent damage and or losing their lives. So thank you for giving us that landscape. And now it's about the policy. How do we change what we see happening? If something is systemic, has it moved, or there are no resources being funded, the people we elect to office across this country should be held accountable that everyone has the same rights and privileges, not just some people in some towns, in some areas, but everyone should have the same access. And I'm going to bring now our representative, Zakiya Summers from Mississippi 68th District, who will talk about the policy implications that we should be aware of. Let's receive her with a round of applause.
Good afternoon and happy Founders Day. Isn't it a finer day to be in the city of Jackson? We appreciate you all so much for being here. Today we are standing at the intersection of legacy and urgency. Zeta Phi Beta Sorority Incorporated has chosen to bring our Founders Day to what many of us know as the ground zero of Mississippi's maternal health crisis. Not for symbolism, but for action. As the only member of this sorority in the Mississippi legislature, I am thrilled and joyfully overwhelmed to speak about this important issue and co-host tomorrow's Community Blueprint event. Because Mississippi's maternal mortality rates are not abstract. They are not just statistics. We've heard the stories. Thank you so much, Doc, for being here. They are names, families, empty cribs, unanswered phone calls, and futures that never get told. And we are here today to say clearly, this crisis is not inevitable. It is policy made, and it can be policy fixed. And I learned from our national NAACP president, Mr. Derrick Johnson, who is here today, that systemic change is rooted in policy change. And so we are here today to announce our comprehensive maternal health policy package that I and several colleagues will be advancing in the Mississippi legislature. I do have one colleague here, Representative John Faulkner from Holly Springs. Thank you for being here. This piece of legislation will treat maternal health as a public health emergency, economic issue, and human rights issue that it is. So the first piece that we're going to be introducing is called Ensuring Emergency Pregnancy Care Act, which makes it clear that no pregnant person in Mississippi should ever be denied life-saving or medically necessary emergency care, period. This bill establishes clarity for providers, protections for patients, and accountability for systems that fail them. Second, we are introducing the Mississippi Maternal Health Omnibus Act, or what we call the Momnibus Bill. And I truly want to thank the Mississippi Black Women's Roundtable, my good friend, executive director of that organization, Cassandra Welchland, for her leadership and for her advocacy support in forming this piece of legislation. It is a multifaceted, comprehensive bill, and I'm going to tell you a couple of things that it will include. First, it will include a lactation consultant training pipeline. It will include depression screenings for pregnant and postpartum women. It will include coverage and reimbursement for home blood pressure monitoring. It's going to include implicit bias training for all healthcare workers. And you heard why that is so important. Because a mother, just because of the color of her skin, should not just not be believed when she's going into the doctor's office and expressing what's going on with her. It could be the matter of life and death. It's also going to include workplace accommodations for pregnant and postpartum women. It's going to exempt taxes on diapers and essential baby items. It's also going to create telehealth pilot programs for prenatal, postpartum, and maternal mental health services. And it's also, there's no good policy cannot be unfunded. So we're going to include some money in there, right? We're going to include community-based organization grants that can assist us with some of the barriers that we've heard from women that they are experiencing, like child care, like transportation, etc. Third, we can't forget about our dads. We are also introducing the Mississippi Dads Matter Act because maternal health is family health. Our fathers matter, not just emotionally, but clinically, socially, and economically. This bill will embed father engagement into maternal care systems so families are supported and they're not isolated. Fourth, we're introducing the Mississippi HBCU Maternal Health Workforce Pipeline Act because representation saves lives. Our HBCUs must be central to training doulas, midwives, lactation consultants, nurses, social workers, and public health professionals who understand our communities and are committed to serving them. And finally, we are codifying something that should have never been optional: nutritional counseling as a core component of maternal care in Mississippi, from pregnancy through 12 months postpartum, with full Medicaid and private insurance coverage. You cannot just simply talk about maternal health without talking about food access, chronic disease, breastfeeding support, gestational diabetes, which I had with my first pregnancy, hypertension, and health literacy. This is what real maternal health reform looks like: comprehensive, preventative, community-centered, and accountable. And I want to be clear. This work is not about politics. This is about people. This is about our mommies. This is about our babies. This is about our communities. It's about Black women in Mississippi being 3 times more likely to die from pregnancy-related causes. It's about rural hospitals, many of you from rural communities that are on the brink of closure. It's about moms driving hours just to receive prenatal care. It's about mental health going untreated. And it's about too many families being told, this is just how it is. Well, this is not how it has to be. I am forever grateful to President Grant, South Central Regional Director Washington, the mighty Mississippi of Zeta Phi Beta Sorority Incorporated, State Director Dr. Ellis, the Mississippi Legislative Black Caucus, March of Dimes, and all our partners, our providers, advocates, and families for helping us to push this work forward. The power of she is not a slogan, it is a strategy. And today we are turning that strategy into policy that will ensure our mothers not only survive pregnancy, but thrive in motherhood. So what can you do? Well, you can help us move these measures forward by sharing your story, engaging with your legislators, promoting these issues on your social media and in your community, because together we will transform our maternal health in Mississippi. Say it with me. Together, we will transform maternal health in Mississippi. Thank you all so much.
Thank you so much, Representative Zakiya Summers. We are so proud. Can we give another round of applause? that's why this became a national mandate, because maternal and infant health is a national issue with local consequences. And this maternal health emergency reflects what we see across the country, and we're using our national platform to elevate local solutions. And this initiative really demonstrates how legacy organizations can respond to these modern challenges. So thank you again, Representative Summers. So before we move on, we do have a guest with us. I understand Mayor John Horn from the city of Jackson is stopping by the community blueprint, the power is she with Zeta Phi Beta Sorority Incorporated. So, Mr. Mayor, we will allow you an opportunity to address us.
Thank you, International President Grant. To my brothers, the men of Sigma, to National President of the NAACP, Derek Johnson, to State Director, Portia Ellis, to Regional Director, Kenya Washington, to the International President of Zeta Phi Beta Sorority, Dr. Stacia N.C. Grant, to all of our partners who are joining us in this important initiative and effort. Last night, I was with a group of faith-based persons. About 500 folks showed up to respond to a call to action for our community and the revitalization and resuscitation of our community. This morning, we were able to help give the charge to about 600 Jackson State University The I Love students in commemoration and celebration of the birthday of Dr. Martin Luther King Jr. Yesterday, I had an opportunity to be part of a $50 million announcement for a mixed-use development in our city, the first $50 million development that's happened in 5 years. 2 days ago, we reopened the largest performing arts facility in the state of Mississippi called Thalia Mar Hall. And boy, did we reopen it, with the very first presenter at that facility's reopening being none other than former Vice President Kamala Harris. And to be here celebrating Founders Day and to be amongst all these beautiful Zetas, you can't tell me I'm not having a good week. And on such an important occasion to announce and launch a maternal and infants health wellness day, making it a reality for the city of Jackson. This gathering speaks of who we are as a community when we protect the health of black mothers and babies. We strengthen every neighborhood, every family, every future in organizing, to everyone serving, standing with families. I say thank you. Your work saves lives and gives hope. The city of Jackson is proud to partner with you and to lift up this effort, not only in these 2 days, but throughout the year. And Madam International President, in recognition of this effort that is being launched by Zeta Phi Beta Sorority and their many partners, it is within my power to issue a proclamation every now and then. And so in commemoration of these next 2 days of effort to designate Black maternal and infant health wellness day's initiative, it gives me great pleasure as mayor of this city to declare that January 16th through 17th, 2026, to be Black Maternal and Infant Health Wellness Days in the city of Jackson, and to encourage all residents to join in advancing awareness, education, and action in support of healthier mothers, infants, and families across our community. And Dr. Grant, it gives me great pleasure in your capacity as the international president of Zeta Phi Beta Sorority that we present this proclamation to you.
Let's give our mayor a round of applause. Thank you again for this proclamation and for the partnership in this work. And it doesn't hurt that you're my frat brother, too. So we appreciate you. Okay, as we continue this press briefing, it's really to highlight the continued ways that we have been at the forefront of this work. Since 1971, Zeta Phi Beta Sorority Incorporated and the March of Dimes have addressed maternal health through our Stork's Nest, an incentive-based program reducing low birth rate and infant mortality in low-income communities by rewarding prenatal doctor visits with points for essential baby gear. Zetas bridge the gap between clinical care and community support, just to name a few. Our proven impact lives in our legacy of care right in Montgomery, Alabama. With Alpha Rho Zeta, the nest serves as a lifeline in a state where 40% of the counties are maternity deserts, providing permanent resources and stress reduction techniques to combat weathering in Black mothers. Our innovative success is in chapters like Houston, Texas, Lambda Zeta, and Little Rock, Arkansas, Alpha Mu Zeta, who have pioneered e-learning and virtual curriculums. And these models ensure that the borderless service reaches more mothers in remote Delta counties or those without transportation, preventing poverty from being a barrier to life-saving education. And the national gap, despite our active locations, critical maternity care deserts persist. And women like Ebony Johnson in Charleston, South Carolina, are unnecessary victims. Ebony was an example of how weathering and systemic bias led to the dismissal of life-threatening symptoms in Black women. Despite a history of hypertension and reporting severe headaches and swelling, her concerns were not acted upon until the loss of her twins. It continues through the Southwest and the Midwest, like Middle Georgia and South Carolina, which received an F from the March of Dimes. Lack sufficient nests, leaving 18% of women without adequate care. The care corridor from Indiana remains a major gap in Indianapolis, and Black mothers die at twice the rate of white mothers. Even high medical literacy can't overcome the systemic inequities found in these unserved regions. And the rural isolation in places like Montana and West Texas, geographic isolation causes 13.5% higher mortality for minority mothers who must choose between gas or food and a prenatal checkup. Filling the gap, a Stork's Nest fills these voids by providing community trust in areas where mothers fear the medical maze or systemic bias. Zetas offer a culturally competent home that incentivizes consistent monitoring. This is the presence that helps to identify early warning signs of preeclampsia and cardiovascular failure, the leading killers in these undeserved communities. And as we are addressing this right here in Mississippi, you've heard the stats. And to combat these disparities, Zeta utilizes our Stork's Nest program right here in Mississippi, held in the Jackson area by Alpha Delta Zeta chapter and South Haven Psi Beta Zeta chapter. Let's give them a round of applause, because these nests serve as trusted community hubs that bypass the bias, offering culturally competent prenatal education, postpartum monitoring, and fills the critical trust gap in Mississippi healthcare system, ensuring that high-risk symptoms are identified early and mothers are empowered with life-saving knowledge. And to this end, we are excited that the March of Dimes has partnered with us on this effort, bringing the Power of She community blueprint to Mississippi. And without further ado, for brief remarks, I'm introducing Michaela Penix, who is the Director of Community Mobilization for the March of Dimes.
Good afternoon. So I am excited to be here, and I would be remiss if I didn't say Happy Founders Day to these finer ladies of Zeta Phi Beta Sorority Incorporated. Yes, please give yourselves a round. I also want to take my personal privilege to tell you that it was a Zeta woman that brought me to March of Dimes many years ago. So I am forever indebted to the finer ladies of Zeta Phi Beta for helping me establish this career and be able to be the voice to bring communities together to highlight these issues for our community, for women who look like many of us in here with advanced degrees, have great careers and positions, good insurance, but still remain the women who are at the greatest risk for maternal mortality. And I am privileged to bring attention to the issue of infant mortality here in Mississippi. So I'm also honored to stand here on behalf of our president and CEO, Cindy Rahman, and our chief medical and health officer, Dr. Michael Warren, to affirm our commitment to supporting the infant mortality public health emergency here in Mississippi. So as Madam Grand already mentioned, each year, March of Dimes, we release a report card and we look at our maternal and infant health across the country within the District of Columbia and Puerto Rico. And we assign each of these areas a grade based on our goal to see every state with a rate or a percentage of births that have less than 8.1% of preterm births. And that's a grade of A minus. And I know we're all scholars in here, so we aim for these A's, right? We're college educated women. So the states, counties, and cities that have a grade of F, they have 11.5% or greater births that are preterm. So these are the babies that are born too soon. And we highlight preterm birth because that is one of the leading causes of infant mortality. And when we look here in Mississippi, 15% of babies are born preterm. So it's well over that 11.5%. And that puts Mississippi ranking 52 of 52 on our report card. However, we also take a look at the 6 counties or so within each state to see who, these are the counties that have the greatest number of births. And what we saw here in Mississippi, that 4 of these 6 counties with the greatest number of births, they have seen some improvement. So I want to make sure that we applaud the efforts that are happening a lot because of what you all are doing out there in the community. Yes, please give yourselves a round. So we're standing here in strong partnership with all of these organizations. We have distinguished organizations and partnerships. I'm so proud that we are historical partners with Zeta Phi Beta Sorority Incorporated. And what we're doing is forging solutions. As Madam Grand said, we're not just bringing attention, but we're forging solutions by way of advocacy, public health innovation, and remarkable community engagement like our historic signature program, Stork's Nest. The toughest solutions can be solved when we all come together through mobilization and partnership. And I'm proud to be a part of that effort here in Mississippi. And I encourage all of you to visit our website at marchofdimes.org to see more of the work that we can do together. We have mobile units that bring prenatal health care to communities instead of asking communities to go to the clinics. We're also working tirelessly with all of our legislative partners to make sure that we can bring to fruition innovative solutions like the Momnibus. We want to make sure that every community has the best chance to have the best possible start. And we know that every baby deserves that, without regard for their race, ethnicity, geography, or income. But mostly I know that when we all come together, even the toughest problems can be solved. So I thank you for allowing us the opportunity to be here. I'm excited to be a part of tomorrow. I heard that we were putting together 1,920 diaper kits to go out to the community, and I'm proud to say that March of Dimes was able to supply many of those items because we believe in the power of she.
Thank you so much, Michaela. She truly is a blessing to work with and committed to this work. Next, we will hear briefly from the Black Women's Roundtable, who planted the seed when I met Cassandra Welchin and listened to what was happening here. She's the executive director, and we're so thrilled that we were able to join in what you will see tomorrow with our activation here in Jackson. And we're also expanding it thanks to the unconquerable South Central region and the state of Mississippi in Cleveland and Canton to get into those areas that truly have the most challenge with access to care. So welcome, Cassandra.
Good afternoon, everyone. It was so good. We had a great, it was divine when we came together at Essence and just had the conversation, and we sat together with my deputy director, Carla Edwards, and we just began to really talk about what is possible. And so I just want to thank you, Dr. Grant, for taking the vision and running with it and allowing community to partner with you. So let's give it up for Dr. Grant one more time. And I just want to say happy Founders Days to so many of us. Happy Founders Week to everybody. Yeah. So good to be here with y'all. So I am Cassandra Welchland. Oh, and Melanie Campbell says hello to you. Executive Director of the Mississippi Black Women's Roundtable, where we shift power at the voting booth and the policy table for Black women and girls in the state of Mississippi. We believe that the policy table should look like people's kitchen tables. Amen. Amen. It should look like that. And we're clear about our vision that liberated Black women and girls building joy, justice, and unstoppable power is where we're trying to go. We unapologetically affirm that Black women and girls are not just deserving of liberation, we're the architects of it, the visionaries collectively shaping a just world. I think we all can give that a round of applause. We are the architects. So that's why I'm honored to stand here with Zeta Phi Beta Sorority Incorporated, celebrating 106 years of scholarship, service, sisterhood, and social action. Your Power of She initiative could not be more timely, as we've heard so much from a lot of the colleagues who've already came before me. As this nation and families are facing the loss of SNAP, child care, Medicaid benefits, insurance rates are about to go up, and here in Mississippi, as you have heard, we're facing a public health emergency with maternal and infant health. At Mississippi Black Women's Roundtable, we see these realities every day. And so we are here to see, we also see the power of what happens when Black women lead with clarity, courage, and community. And that's why our Mississippi Women's Economic Security 2026 legislative agenda is laser focused on advancing social, health, and economic justice, because we understand that we work at the intersections of it all. Well, my good friend Valencia Robinson, there she is right there. She always talk about the intersectionality of this work. We don't live single live issues, right? And so this session, as you all have heard, we will be advancing and working with Zakiya Summers and other legislators to advance the maternal health omnibus bill. But Mississippi's, I got to talk, though, and just lift up the other partners in the room. Teen Health, that was mentioned. But Mississippi in Action with Valencia Robinson. 6 Dimensions with Nikitra Burse, who I never do nothing without her when we're talking about this work. And so it's just really important, because what we're talking about here is that we are fighting to really get people paid, right, so they can take care of their households. We're fighting, right, to make sure that, because we know that gas prices are going up. And so, again, we're working at the intersections of race, gender, and economic justice. And healthcare is an economic justice issue. Y'all agree with that? It is an economic justice. So we'll be pushing for, along with the Momnibus bill, we'll also be pushing for comprehensive paid family and leave, fair wages, earned safe and sick leave for those that are fleeing domestic violence situation, and a competitive teacher pay. It is the foundation that allows women to care for their families, stay in the workforce, and live with dignity. We can't talk about health again without talking about wages. Mississippi has a dual wage crisis. Our minimum wage has been stuck at $7.25 for 17 years, while the cost of groceries, rents, lights, gas, everything keeps going up. 29% of our workforce earn less than $15 an hour. And these are women who are trying to keep food on the table and care for their families. The other crisis that accompanies that is tip workers, mostly women, mostly black, and mostly people of color, are still being paid $2.13, a wage rooted in legacy of slavery. No woman should have to depend on unpredictable tips to make their wages. These are pocketbook issues. It determines whether a mom can afford childcare, diapers, a woman can afford her medication, even our elders, if they can afford theirs. It's I would say, and it determines whether a woman, a mom, can take her family on a vacation. I'm going to just say that again because some people think that's a privilege, but it should not be a privilege because we understand that rest is resistance. And finally, we are advancing policies that strengthens our democracy. And I'm sure Derek Johnson will get up here and he's going to talk a little bit about that because we are in a crisis right now. We're talking about our vote. I always say that policies is the work of our democracy, but voting is the heart of our democracy. And so today, as Zeta Phi Beta honors 106 years of service, I want to affirm that Mississippi Black Women's Roundtable stands with you. Your Power Sheet Blueprint mirrors the work we are leading at the Capitol and in communities across the state. Together, we're just not responding to crises. We are building systems rooted in joy, justice, and unstoppable power for Black women and girls. Thank you all so much for your leadership, your partnership, and unwavering commitment to our people, to our place that we call Mississippi and that we love. Thank you.
Thank you so much, and we're excited about the partnership. And we have a few more partners in the room that'll be speaking over the next 15 minutes as we start to wrap up. But it's important to understand that Zeta Phi Beta Sorority Incorporated doesn't stand alone. It's about relationships, it's about community, and how we come together to make sure we can provide the transformation. And Chi Eta Phi Sorority Incorporated is a nursing sorority. And when they found out what we were doing, they said, absolutely count us in for the services that we'll be providing at the Jackson Medical Mall. We're going to hear from Ms. Deborah Stamps, who is the National First Vice President of Chi Eta Phi Sorority. Let's welcome her at this time.
Thank you so much. Good afternoon, everyone. Dr. Grant, thank you so much for the opportunity to be here. Happy Founders Day to all of you. It's a pleasure to be here. I'm here on behalf of our national president, Samantha A.G., who is our 23rd national president of Chi Eta Phi Sorority Incorporated. It is my privilege to present a proclamation recognizing Zeta Phi Beta Sorority Incorporated as you commemorate 106 years of service, leadership, and impact. This proclamation reflects more than recognition. It reflects urgency. Mississippi continues to rank among the states with the highest infant mortality rates in the nation, and the declaration of a public health emergency reminds us that these outcomes are rooted in systemic gaps, not individual failures. Maternal and infant health outcomes are shaped long before birth by access to health care, education, transportation, nutrition, and economic stability. Health equity is inseparable from social and economic justice. The Power of She Community Blueprint places services where it is needed most and demonstrates what is possible when trusted partners, legislative voices, and healthcare leaders come together. No single organization can solve challenges of this scale. But, or however, collaboration creates sustainable pathways to change. Chi Phi Sorority Incorporated proudly stands in solidarity with Zeta Phi Beta Sorority Incorporated, affirming our shared commitment to justice, partnership, and community-centered solutions to eliminate maternal and child mortality. With deep respect and admiration, I present this proclamation to you. And I will just highlight areas of it in the interest of time. Zeta Phi Beta Sorority, a 106-year-old service organization founded on the principles of scholarship, service, sisterhood, and finer womanhood, continues to honor the vision of its founders through advocacy and action addressing the pressing social issues of our time. Zeta Phi Beta Sorority Incorporated and its members across the United States and 12 countries worldwide continue to embrace extraordinary power of she, advancing social justice, health justice, and economic justice in communities they serve. In the state of Mississippi, which is one of the highest infant mortality rates in the nation, has declared public health emergency to maternal and infant health, highlighting systemic inequities that requires urgent, coordinated, and justice-centered responses. This Founders Day 2026, the Jackson Medical Mall represents a strategic community activation convening partners, healthcare professionals, and legislative voices to provide critical services, resources, education, and information. Now, therefore, be it proclaimed that Chi Phi Sorority Incorporated hereby honors and celebrates Zeta Phi Beta Sorority Incorporated on the occasion of its 106th anniversary, recognizing its enduring legacy of leadership, advocacy, and transformative service. And be it further proclaimed that Chi Phi Sorority Incorporated commends Zeta Phi Beta Sorority Incorporated for its unwavering commitment to advancing justice, addressing systemic inequities, and improving health outcomes through community-centered action and strategic partnerships. Thank you so much.
Thank you so much for the proclamation and the partnership and the work we will be doing tomorrow during the live activation. We continue to highlight partnerships that matter, and the NAACP is one of our long-standing partnerships as we continue to renew our memorandum of understanding because collectively we are transforming the world. I do want to thank my friend Derek Johnson for changing his schedule to be here because he thought it was that important for the NAACP to stand with Zeta Phi Beta Sorority Incorporated today, and we welcome him now to the stage. We can give him some more love.
Happy Founders Day. I don't have any prepared speech, any statements, but when President Grant told me she was going to be in Jackson, I said, I can't let her come to Jackson and not be here. We have been together in probably, I don't know how many places over the year. Because every time there is one or more black folks meeting somewhere, she's going to be there to represent, and she represents well. She represents well. I can only imagine what her closet looked like, because I don't think there's anything in the closet other than blue and white, because she shows up. We are proud to be partners with Zeta Phi Beta. As an organization, our focus is to make democracy work for all, and democracy today isn't working for many of us. And we cannot push back unless we align all of our resources together and focus on November, because what's happening in this country coming out of the White House is an attack on all of us. is an attack on all of us. And when you consider the fact that this Supreme Court has given ICE license to pull people over based on their racial profile, which is illegal, is an attack on us. When you consider that the individuals they are pulling over is just not the Latino community. Because what they're doing in Minneapolis is targeting the Sudanese community, and I promise you, if you go there, you wouldn't know if they were Sudanese or your cousin. But more importantly, recognizing that this administration had two primary goals. Started off with one goal. That one goal was to change tax policy. They threw so much stuff against the wall to distract and distort the message so they can pass their tax bill, and they did that. And then, as they called everybody as pedophile, we realized that they're the pedophilias. And they are fighting now to prevent not only the Epstein files released, if they get released, they want to create so much smoke. So we want to go take Greenland. We're going to pick a fight with Canada. We're going to go take a president out of Venezuela. We're going to bomb Nigeria. We're going to send ICE to Minneapolis. We're going to send the National Guards to LA. We're going to continue to ramp it up to distract and distort because there's something in those files that really indicate not only the person in the White House, but so many other people. And we must turn out to vote in November to try to put this thing in check, because if we don't put it in check, we won't have a democracy. So thank you to the ladies of Zeta Phi Beta for standing on your principles and aligning with so many of us across the country, because we are all that we have. And if it's not for us, with us, who else would be there? Peace and power.
Thank you, my brother. We appreciate it, and we will continue to stand together, because the power sheet, when we talk about social health and economic justice, is all interconnected. And when one community fails, our communities suffer at a higher rate. So we can't afford to turn a blind eye, and that's why when we talk about the Power She Community Blueprint, it includes that economic justice. And we're proud to be partners with D Free Foundation, founded and led by the one and only Dr. DeForest Buster Suarez, who is here to stand with us for this activation, and he will be sharing a little surprise that he'll be giving out tomorrow. But we are proud not only of the debt reduction, but the financial education. As you heard, the intersection of what challenges our mothers and families of being able to thrive. Welcome, Dr. Suarez.
Thank you so much, Dr. Grant, and happy anniversary, happy birthday to Zeta Phi Beta. Founders Day, holiday, and to my brothers at Phi Beta Sigma, all of the officers, to our legislators. Dennis Johnson is, I believe, the greatest leader we have in the civil rights movement today in this country. Dennis, God bless you. We've agreed that economic justice is a part of this maternal health movement and core to our freedom. And foundational to economic justice is financial literacy. Too many of our community members and leaders are paying 28% interest on car loans, paying 25% interest on credit cards. We have been the targets of predators in the financial space since sharecropping. And so the partnership between D Free and Phi Beta Sigma and Zeta Phi Beta is to help our people liberate each other from the stresses that are caused by economic injustice. And when we do that well, we are not only paying attention to our money, but making our money work for us. There is a direct correlation between mental health and financial health. That financial stress causes health decline. and health decline causes financial stress to the point where the number one reason for bankruptcy in this country is the inability to pay for medical bills. And so I'm grateful to Dr. Grant and all of the leaders in Zeta Phi Beta. And we are committed tomorrow to give away 250 copies free of our newest book. And we are committed to free training and free access to our resources for Zeta Phi Beta leaders. As it was said earlier, if we don't free us, no one's coming to help. So God bless.
Thank you, Dr. Soares. We appreciate you. And we want to thank all of our partners for making this happen. We have about 4 more who have brief remarks that they want to stand in unity. But before we continue, I want to just pause and let's thank the Jackson Medical Mall Foundation for hosting and partnering with us so that we could not only have this press briefing today, but also our activation tomorrow. We want to thank Black Health Matters, Rosalind Young Daniels, who's a proud member of Zeta Phi Beta Sorority Incorporated, as well as St. Jude, who you will hear from tomorrow and see activated, and our other local partners. But now we're going to hear from NCNW, Victoria Sharp, who's the Mississippi State President, and following her, we'll hear from Black Vote Matters, Ebony Sampson, who is the Donor Relations Coordinator, and our final speaker will be Glenda Carr from Higher Heights, who is the CEO and made it here and changed her schedule as well, and she's accompanied by Shannon Arthur.
Good afternoon. Happy Founders Day, Madam International President Dr. Grant. We are so honored to be here and partner with Zeta Phi Beta Sorority Incorporated as you celebrate Founders Day 2026 with the Power of She Community Blueprint, and to stand alongside an organization whose enduring legacy of service, scholarship, sisterhood, and social action continues to shape and strengthen our communities. In Mississippi, where maternal health outcomes continues to disproportionately impact Black women and families, this work is especially vital. Through education, prevention, and access to care, we affirm the sacred value of mothers and the strength of families from pregnancy through postpartum, including the importance of early childhood wellness and timely immunization that protect our babies and support healthy starts in life. Healthy mothers and protected children are the foundation of strong communities. As we are reminded, no single organization can solve a crisis of this scale. It is through partnership, shared purpose, and collective action that real and lasting change is achieved. Guided by NCNW pillars of health care, economic empowerment, education, and social justice, we stand in unity with Zeta Phi Beta Sorority Incorporated to uplift communities, protect wellness, and advance a healthier, more equitable future for all. As we move forward in this sacred work, we are reminded that faith calls us not only to believe, but to serve. May God continue to order our steps, strengthen our hands, and bless the work we do together for the good of our communities. On behalf of the Mississippi State Coalition of the National Council of Negro Women, and as its state president, I thank you for this opportunity to stand together in service, trusting that what we do in unity today will yield blessings for generations to come. To God be the glory.
Thank you so much. We are proud to stand with NCNW as one of the affiliate organizations and led by Reverend Siobhan Arline Bradley and Dr. Lois A. Keith. We appreciate the continued support as we have coming forward Ebony Sampson from Black Votes Matter. We also have with us representing the Divine Nine. We appreciate the response and support from my colleagues. Not only am I the international president and CEO of Zeta Phi Beta Sorority Incorporated, but I have the great honor of being the chair for the Council of Presidents of the Divine Nine. So I actually bumped into my sister president from right here in Jackson, Cheryl Turner, as she was en route to represent her Founders Day weekend as well. And now we'll move to Glenda Carr from Higher Heights. As we know that our Black Votes Matter team will be sharing information tomorrow. And after Glenda, we will hear from Carla Edwards, who is the Mississippi State Coordinator for Delta Sigma Theta Sorority Incorporated. And then we will meet one of our partners who has so graciously been working with our team here, Phelan Brewster from the Jackson Medical Mall Foundation.
Good afternoon. What better way to end Founders Week than to jump on a plane after I set it off last night? Your president is a visionary and a coalition builder. It is the testament of why we're here today. We are here today because we honor the 106 years of Zeta Phi Beta Sorority Incorporated, but to name not only to celebrate, but to name what this moment demands of us. Service must be matched with political power, and power must lead with public policy. Let's be clear. Black women are facing maternal health crisis that is unacceptable in this country. And when a state declares a maternal and infant health public emergency, that is not a failure on Black women and Black mothers. It is a failure of leadership systems and political will. Black women have been the backbones of our communities, our families, and this democracy. And as we look towards the 2026 election, Black women are clear about our focus. We are going to be organizing, mobilizing, and electing Black women and Black leaders and leaders who will deliver on real policy solutions for us. Black women Higher Heights is your political home for Black women, where we are unleashing the political power of Black women and our leadership potential. We are your partners to help Black women to vote, run, win, and lead, not just to show up at the polls, but to elect Black leaders who have lived experiences that will shape public policy, especially when it comes to maternal health, health crisis, access, and economic security. Because here is the truth. You can't fix a Black maternal health crisis without having a Black woman at the decision-making table. Mississippi's crisis didn't happen overnight. This crisis didn't happen across this country overnight. It is results of decades of policy decisions made without accountability and without the voices of women that were impacted the most. That is why Higher Heights is proud to support and stand alongside Black women leaders in Mississippi who are ready to champion maternal health and health equity in 2026. Representative Zakiya Summers is the example of why we elect Black women. It is not symbolic. It is strategic. It is necessary. It is life-changing, and it is changing our communities. So as we celebrate Zeta Phi Beta Sorority Incorporated's Founders Day, 106 years rooted in scholarship, sisterhood, and finer womanhood, we recommit to do the same. Higher Heights is proud to be a partner aligned in service, civic engagement, building on the political demand that is needed for this moment. We believe in the power of she, and we know that when Black women lead, we move this country to higher heights.
Thank you so much, Glenda. Truly appreciate the partnership and the sacrifice to move through your schedule of being here. And we are going to now hear from Carla Edwards, Delta Sigma Theta Sorority Incorporated, Mississippi State Coordinator. When we say D9 Stronger Together, it's not just a hashtag. It's how we must move. As I say frequently to all of our members, for those who believe in God, he's not going to ask you what organization you were a part of when you get to the pearly gates. It's what you do for the least of these that matters, and we truly are stronger together. So welcome, Carla.
To Dr. Stacy N.C. Grant, 26th International President and CEO, South Central Regional Director Kenya L. Washington, and Mississippi State Director Dr. Portia E. Ellis, and all the finer women of Zeta Phi Beta Sorority Incorporated. Happy Founders Day, and congratulations on 106 years of sisterhood, service, and steadfast commitment to our communities. On behalf of the International President of Delta Sigma Theta Sorority Incorporated and the Board of Directors, Soror Cheryl W. Turner, I bring you greetings in her absence. Dr. Grant, Delta Sigma Theta is honored to welcome you to the state of Mississippi. Our 34 chapters stand with you today as you lift up one of the most urgent issues facing Black women in this country. And that issue is that Black women are dying while giving life. In Mississippi, Black women are 3 to 4 times more likely to die from pregnancy-related causes, not because we are careless, not because we are uninformed, but because systems meant to protect us too often fail us. Lack of access to quality care, lack of continuity, lack of respect for our lived experiences. This is why the power of she meets the moment of now. Because the power of she reminds us that she is strong even when systems are weak. She is heard even when institutions try to silence her pain. And she is essential to the future of our families, our communities, and this nation. As sister members of the Divine Nine, we know this truth. We wear different colors, yes, but every day we walk this world as Black women. And in Mississippi, oppressive systems like limited access to health care and the absence of Medicaid expansion threaten all of us, regardless of our letters. They know what Black women birth. We birth brilliance. We birth leadership. We birth movements. And yes, we birth change. Delta Sigma Theta has long stood in this fight, from our historic partnership with the March of Dimes to our continued commitment to physical and mental health as one of our 5 programmatic thrusts. And today, we are proud to stand with Zeta Phi Beta as you call us to action, because together, my Divine Nine sisters, we will not watch Black women suffer in silence. Together, we will not accept preventable loss as inevitable. Together, we will win this fight for our sisters, our daughters, and generations yet unborn. Dr. Grant, on behalf of Soror Turner and Delta Sigma Theta Sorority Incorporated, it is my honor to present you with this token of appreciation and recognition for your leadership, your advocacy, and your unwavering commitment to Black women everywhere. May we continue to stand, may we continue to speak, and may we continue to ensure that she survives. Thank you.
Thank you so much. Can we give another round of applause to our sister? It has been Founders Week, dare say Founders Month, because every time January comes around, I think the internet is sick of us. But the good news is that we get to do this work in honor of our founders and ensure that communities understand that it's not just about the colors that you see and the strolls and the step. It's about the service that we give that transforms communities. So before I invite our medical mall partner to come up, I want to acknowledge all of those who've helped to make this possible. And I want to start again with acknowledging the unconquerable South Central Regional Director, Kenya L. Washington. Our mighty Mississippi State Director, Dr. Portia Ellis. I want to thank our International Director of Observances, Cynthia Drakeford in the back, who has been the taskmaster getting us to this point. Our International Director of Live Events, Tamara Manning-Gordon. Our International Director of Technology, Akila Tompkins-Robinson. Our International Director of Protocol, Regina McLaren. Our International Z-Hope Director, Dr. Lene Laws. Our IHQ Director of Digital Strategies and Information Systems, Reggie Knox, who's in the building, and also a brother of Phi Beta Sigma. I want to thank also our whole protocol team. Can the protocol team stand? You know, it's a hard job, led by our Sora Skinner here in the South Central region. My chief of staff and executive team. And I want to acknowledge the chapters that are here that said, you know, we're coming on board because we want to make sure that while this is happening in our state, that we truly are ensuring that no one dies on our watch. So as I call your chapter's name, please stand and wave. Alpha Delta Zeta chapter in Jackson, Tau Upsilon Zeta in Clinton, Omega Psi Zeta in Louisville, Zeta Psi Zeta in Clarksdale, Theta Pi Zeta in Mount Bayou, Rho Iota Zeta in Mendenhall, Omega Tau Zeta in Brandon, Tau Phi Zeta in Canton, Psi Kappa, Delta State, Nu Beta, Tougaloo College, and Lambda Phi from Millsound College. Millsap. Okay, y'all got me down here in the Delta, getting all these names right. But I want to thank you all for your partnership in making this happen. And I want to bring forward our hosts. So let's do a big round of applause because they complimentary partnered with us to make this happen because they know we are all nonprofit organizations. Can we say amen? So we bless God for Fallon Brewster here to represent the Jackson Medical Mall Foundation. Thank you. Here you go.
Well, good afternoon. I have the pleasure of being the last speaker, so I know what that means. But I'm Fallon Brewster, and I come in the capacity of Chief Planning and Strategy Officer for the Medical Mall Foundation. But I stand as a mother, I stand as a woman, and I stand as the daughter of a mother who was forced to birth me in the hallway of a local hospital. So I can really appreciate the reason that we're here today. And I stand as a representative of my executive director, Mr. Primus Wheeler Jr., and on the shoulders of our founder, the late Dr. Aaron Shirley. His life's work was dedicated to healthcare access for the underserved. And we stand in his theater, in this medical mall, on our 30th year anniversary year. So this is very significant. Y'all's Founders Week. It's our 30th anniversary. I love it. We're happy to have you here because this work matters. And as we have heard so many speakers state previously, Mississippi is facing a declared public health emergency around maternal and infant health. The Jackson Medical Mall exists to address these kinds of crises. So we are honored to host Zeta Phi Beta Sorority Incorporated as they activate the Power of She Community Blueprint. This work aligns directly with our mission to connect healthcare services, social services, and economic opportunity all under one roof right here at the Jackson Medical Mall. I won't even read the rest of this because I know you guys have a lot to do, but we are excited to have you here. We're honored, and we thank you guys so much.
Thank you. I don't think it's accidental. Those are what I call the God instances, right? That it aligned with our Founders Day. So as we come to a close for those who are viewing virtually and participating in service all around the country, the reports continue to come in that Zetas are taking care of business with 106 years of service. I want to thank again our Z-Hope team because they pull together the toolkits for this blueprint to happen, and our International Director of Program, Krista Jones, and co-director, Yvette Carter, who've been working with our Z-Hope team with representatives across all of our regions. And I think there's some members of the team that came with Dr. Laws. Can our Z-Hope team stand? Because I want to recognize them for the caliber of work that they do, because Z-Hope is our service engine and is how we're able to measure our impact. I cannot thank you enough for the way that you represent our sisterhood and service. So as we close, our blueprint is intentional, collaborative, and scalable. Jackson represents what happens when national leadership aligns with local expertise, What you will see activated tomorrow here at the Jackson Medical Mall Foundation, as well as in Canton and Cleveland, Mississippi, is the intentional way we are honoring the vision of our 5 founders. As we move forward together, we are asking you to let the community know that we are here. As Michaela Penix mentioned, March of Dimes alone contributed over 1,920 items to be included in meeting our goal for this weekend's activations. We invite all of our partners to invest in the solutions that you've heard here today, not the symptoms of the problem. And we invite those who are listening across the nation to duplicate these efforts so that we can not only create good policy transformation and teach us how to advocate for ourselves. Health equity is not optional. It is justice. God bless you and thank you for tuning in. So as we end this stream, share it with someone, and we can't wait to report out to you what all of our members have been doing across the country for this weekend of service as we prepare for Martin Luther King's celebration on Monday. So as we celebrate our Founders Day, as we do this work, it is one life. If we can save one life, that's one life more that we can check off and say we did our job. We don't know how many people's lives we're going to touch tomorrow. Text a friend, tell everybody, have them come. We have the resources the team has been packing, and we're looking forward to celebrating with you all. There is a small reception that we'll ask you to go outside and have a refreshment or two. I would tell you that I made it, but that would be a lie because I was on the plane getting here. But do enjoy what our family, our Zeta family, has prepared for you, and we look forward to seeing you back in our live activations as we continue the Power of She Community Blueprint. Thank you for your attendance. Thank you for your partnership. And my sorors, you're looking good today. And let's give a round of applause to our Zeta Amici who extend our service, blueprint, and philanthropy in the work that we do. So thank you for being the best friends that we could have. Thank you for your work on the ground, how we move this forward and make sure that the next time I visit Mississippi, that these stats have drastically changed and that we are on the upswing of healthy moms and healthy babies. Enjoy the rest of your evening. God bless you.